Welcome all my friends in TV land. This is Senior Issues, etc. I'm your host, Vita Verdon. And you know, the show is seen at so many different times in so many different areas. I never know whether to say good morning, good evening, good afternoon, good late night. So I've learned to say now just welcome. I'm really happy you tuned in no matter what time you're getting this show. And you know, I try to pay attention very much to what your requests are. And this show happens to be picked out by, we do have a consultant. His name is Phil Hartung, and it was his choice for this show, and I happen to be of the opinion that he made a very good choice. Now, you know, I try to concentrate on your body, soul, and spirit and cover your whole system and anything outside of your system. And this one is focused on personal training. And I happen to have a specialist with me today. She is not only a personal trainer, she is a speaker. She speaks on different subjects that she's going to tell us about. And she also has a special program for cancer, post-cancer patients, and other diseases, which she's going to get into. And she is part of the Advocate Condell Center Club, which is located in Libertyville, Illinois. And what we're going to find out is a little bit about her and a lot about what she has going on in her life and what her passion is, and where she's going to give her some of her secrets and some of her tips and how to extend your life and keep it in a wholeness fashion. And we're happy to have her. I want you to sit back and relax and welcome Carol Dieball. I said it right now, right?
Dieball, yes.
It's so nice to have you here on the show today. Now, what I'd like you to do is just look right into that camera and give our audience some lowdown on yourself, because they like to get up close and personal, and so they like to know a little bit about you, who you are, and whether you're married and what's going on with you. So if you just look into that camera and pour your heart out, they'd love it.
As Vita said, I'm Carol Dieball, fitness instructor at Advocate Condell Medical Center Club in Libertyville. I've been there 5 years. I am married, I have a wonderful husband. I have 2 grown daughters, ages 29 and 26.
Okay, stop right here. 1 smackaroonie for the husband and 1 for each daughter.
Okay, and my little granddaughter, who's almost 1.
Okay. That's for your husband.
And Sonia.
Each daughter, and then for your granddaughter, too. Good.
Okay.
And you live in Libertyville?
I do, and I'm actually blessed to be able to walk to work. I'm very close to the Center Club.
Oh, that's good. And where were you born?
I was born in Evanston. And have been a suburban gal, living my growing up years in Arlington Heights, Illinois, and then most of my adult life between Vernon Hills and then the past decades in Libertyville.
Well, let me ask you this question, Carol. How did you happen to get involved in your line of work?
My degree from way back was actually in health and physical education. Rather than the teaching emphasis, I did a corrective therapy emphasis, which was more like a physical therapy assistant back in the 70s. Ended up in the corporate world for a number of years, and it wasn't until about 5 years ago my role at Hewitt Associates was being outsourced. So my husband said, you know, if you'd like to take some time and get into doing something differently, that would be great. So thanks to him, I took a year and did some coursework to update my degree, and then some certification requirements to become certified as a fitness instructor. And this is my passion. This is what I've always wanted to do. In addition, there was some advanced certification in the cancer exercise specialist area through the American College of Sports Medicine and the American Cancer Society together.
Well, to start with, I'd like to give our audience a sense or a picture of where you're located, and you're part of a hospital system.
Yes.
So could you tell us a little bit about the hospital and where it's located, and how the facility that you work out of, how it's connected?
Sure. Advocate Condell Medical Center is a trauma center rated hospital in Libertyville, Illinois, about 30 miles or so northwest of Chicago. And on that same campus is the Libertyville Center Club. So we're a part of there. And there is a Center Club Fitness Center in Gurnee as well. So there are 2 facilities.
Mm-hmm. So now the Center Club, which is connected to the hospital, so it's interrelated. The therapists from the hospital come over and work. So do you work in the Center Club facilities, but sometimes you work in the hospital too?
I work in the Center Club. We have done some very nice joint programs connected with the hospital. So we have done 2 sessions of diabetes exercise, working with the diabetes nurse educator at the hospital and myself to provide exercise programming. We've done a support group with the diabetes group. And
you're talking about what you speak about. The different programs that you speak about.
Either speaking or the diabetes. We also had an exercise
and you
group,
incorporate
like a 4-week
the exercise with it,
class
I see.
with that.
Okay.
Yes. Mm-hmm.
So you speak on diabetes. What else do you speak? I know that you have a whole program for cancer patients, don't you?
Yes. The Center Club has a program, a 60-day program for anyone within 1 year of cancer treatment. So sometimes it's people currently undergoing therapy or following as survivors. And during that 60 days, they receive a consultation from us, 2 personal training sessions where we set up a program specifically for that type of cancer and where the person is. So one example, a breast cancer patient might have some limitations in the shoulder and arm due to surgery. And so we'll work with exercises up a wall that help to increase that range of motion and gradually get back to where she had been. Some people have had difficult radiation and chemotherapy that has left them very weak. And so we start personal where they are at that level and work gradually building with gentle cardio, gentle exercises, sometimes it's 1-pound weights, and gradually build from there. It's an area where the people can actually have something they can take charge of during a period of life where the chemo maybe is being done to them and they don't have a choice regarding radiation or surgery. But here is a choice, and they often feel much better, feel they can rest better, they have more energy, and are better able to withstand the effects of the treatment.
And I know that there is a once-a-month support group for diabetes.
Yes, correct. And this past month, they had asked us, and I came and spoke to them, and we actually did a few exercises and kind of explained how, with diabetes, to watch that blood sugar and make sure you're exercising when your blood sugar is in the right range, to stay hydrated with drinking lots of water, have that snack on hand that contains some protein and carbohydrates, so things that are specific to their diabetic situation.
And in the process, I know with diabetics, it's in the process of exercising, that also adjusts with their medication. So there has to be a coordination between all of that.
Yes, absolutely.
And so you help them in the coordination.
Well, that's with the diabetes nurse educator. So that's their specialty.
But you all work together.
Oh, yes.
As part of a team, right?
Yes, yes. And sometimes people find after they've been exercising a while, they might be able to reduce some of their medications because the exercise is helping with controlling the blood sugar.
Well, I know as you were talking, you said that there's I know there's a membership because the Center Club is a private club, but you said there's also a 30-day program a person could take as a tryout.
Well, our Dr. Fit program is that 30-day program, and it starts by a doctor actually signing a prescription for exercise, which is wonderful. It can be for any number of reasons, weight management, any type of situation the person might find themselves in. And in that 30 days, we would have a consultation with the person. And
The
then,
consultation consists of a private session.
right,
Where
with
the person
one-on-one with a personal trainer, where we
Alright.
go through the doctor form that they filled out,
Uh-huh.
and we have the individual fill out their own physical activity readiness form, and then we set up the program for them. During the following 30 days, twice a week, they sign up for a personal training session where one of us trainers is available. So we'll go around. It might be a small group of 2 or 3 or 4 Dr. Fit people, and we're available to help with adjusting a machine, perhaps adding more weight as they're ready, and making any suggestions regarding form and alignment while they're doing the exercises.
Well, in the next part, we're going to go into the physical exercise, and you're going to give us some demonstrations, but right now we're going to do Vita's Pearls of Wisdom. There's a few things I want to talk to you all about today that I think are important. One is when you get to a certain stage in life, to loosen the load that we're all carrying on our back, it's really important to learn how to downsize. Now, downsizing comes in every area of our life. And the one place to downsize is go through your medicine chest, first of all. And now there's been recommended that you do not throw any of your medication down the toilet because they don't want it to go into the water, any kind of water supply. So my suggestion to you is to talk to your pharmacist, and your pharmacist will either take them or tell you of a place where you can dispose of it. And as far as diabetics are concerned, is you're never supposed to throw any of your and use needles into your garbage because somebody could, the garbage men or anybody who's processing this garbage could penetrate themselves. Now, there are containers you could buy at any pharmacy, and they're relatively inexpensive. And so you dispose of all your needles there. Okay, that takes care of the medication. And you know, I'm always preaching this on your vitamins. On your vitamins, it's most important that you take your vitamins with some sort of a food intake because that enhances the release of what your vitamins is to do for you. Okay, we got that out of the way. Next thing, go through your clothes. And there's a lot of fine, in any area around that this show is seen, there's a lot of resale shops that you could take it to, that you're going to do somebody some good. So the rule of thumb that I use, you can use your own, is if I haven't worn it in a year, out the door it goes. Okay? And that should take care of all your clothes and all your shoes. The next thing is, as we're aging, I know I don't entertain in the same fashion as when I was a younger person. So if I'm going to entertain, I'll take a person out to dinner now. That's much easier on me than setting up a big entertaining in a small apartment. So take those big serving dishes, and you know what? Don't wait, have the kids hanging, oh, you know, am I going to get that when she dies, or am I going to get that when he dies, you know? Give it to them now, you know, and have the joy of seeing how much they enjoy that. And all those big serving things that you say, oh, someday I'm going to clear it out. And I'm telling you, doing this kind of spring house cleaning is going to lighten the load. It's going to lighten your heart. It's going to lighten your head. And you're going to bring joy into a person's life. Now, I want you to be able to see any of the past shows. Go to seniorissuesetc.org, and you can link. When you go on there, it tells you all the different places that the show is seen, and we must have, I'd say, you know, maybe more than 30 shows online, and there's a link, and you can go link right into the latest show, and the show will go from the latest show all the way down the line. And also there is a link into the blogs, so if you want to go through fast and see what the shows are about, you can the link under the shows is the link to go on the blog, and you could see those on, and if there's a favorite show, you can tell your friends about it. And I thank you for that, and now we're going to get back to Carol, and she's going to show us some physical things. Now let's get into the physical end of your job.
Okay.
I know that you want to give some demonstration of some exercises and some kind of movement that people could do at any age. What do you like to start with, Carol?
Okay. Well, just to preface that, Vita, we understand with the senior population today, and I'm there, I'll be hitting 60 this year, we can be training or working with an 80-year-old person who is interested in doing a triathlon, or we can work with an 80-year-old person who is in rehab and needs help with muscles to get up out of a chair. So that's a big range, and we understand we need to be very flexible and adaptable to the needs and goals of seniors at any point. And at the Center Club, we really welcome everyone. And again, it's the beauty of being connected with the hospital, that we have people come in wheelchairs, with canes, crutches, in a sling. And at any point, it's all about personal best. And Center Club offers free community guest days once a month, and just welcome to come in, bring a friend, and just try out some of these things. I know it can sound kind of intimidating, but that's why we're here as personal trainers, to help walk people through and guide and what is appropriate for them and at the right level, and then it's fun to go from there. So, well, we can start with one thing that maybe everyone at home, just with a towel. This is something that can help with range of motion and flexibility, which is important to keep. Again, any activity, you do want to check with your doctor first and get clearance. Make sure that you have doctors okay to do it. So here's grabbing a towel at either end, just raising up to your range of motion. And when you get to the top, kind of encourage a little more, no strain, no pain, and then slow and controlled, come back down. Another move could be out to the side, where you're stretching and reaching, and you hit that tight point, and then hold it there, 20 or 30 seconds. It can seem like a long time. And then back down. And out to the other side. Up, assisting with the opposite arm.
And then the next thing is, that looks like a jump rope, but it's like made of rubber. What do you call that apparatus?
This is an exercise band. And these are nice because they're easy to have at home. They don't take up a lot of room. When people are traveling, we have them often ask, gee, what can I do while I'm on the road? Well, this can fit in a suitcase. It's lightweight. So, for example, we can do bicep curls to work the arm muscle here by stepping on the tube, and then standing tall, bending the elbows up, and you have that resistance of the tubing. And it can be adjusted if this gets too easy. Then step on it with both feet. Get my wire out of the way. And now it's harder. We have less length of the tubing. Okay, and that's a nice way to work the arm muscle.
And then you have some weights. Now, what weight are those weights that you have?
These are actually 5-pound.
But they can start with like a 2-pound, can't they?
Yes, we have 1 pound, 2 pound, 3 pound. And again, if you have any issues at all, you do want to get doctors okay, particularly arthritis in the shoulder. One thing too with rehabilitation, we use often a different weight in the right arm versus the left, if that's appropriate, if the person has a weakness. Or we use no weight on the weaker arm, but they simply do the motion. So here we're looking at working the upper shoulders, go up and down.
And now we're going to get down on the mat and show us something on the mat.
Yes, it's important to have strong core muscles for our stability. And here, particularly if people have back issues or if you had some surgery recently, this is a way to have the back stable and supported. Tighten those core muscles, press the stomach down so the back is flat on your firm bed or bench, and then raising the knees up and down. You're working those core muscles while you're keeping your back nice and stable and supported.
Well, I know that I'll talk about this all the time because we've kind of pioneered this show, and we've pioneered that seniors are living so much longer now. You know, and I think that since we don't have a roadmap, we've had to like learn as we go on this. And I think you probably are seeing, you were telling me beforehand that you're seeing like a 96-year-old woman, right?
Yes, in our senior strength class on Fridays, and she comes Monday, Wednesday, Friday, does wonderful. We have a woman who's legally blind and comes regularly and exercises. There's programs pretty much every day of the week for seniors, and the water programs, I think you're in those.
I know I belong to a hot water program because I have a large plate in my leg, and the water can't damage me. I can't go on any kind of machinery. You know, so being in, it's actually called an arthritis program, but what it concentrates on is range of motion.
Yes, yes. And then there's water programs in the regular pool as well that are, again, easier on the joints.
Aerobic, isn't it? The water aerobics?
Yes, yes.
Now, what have you learned in this last 5 years? You've probably seen the growth in seniors coming.
Oh, absolutely. Yes, we have a lot of seniors coming. And again, it's the range of many different interests and activity levels. But that the important thing is to keep moving, to have that dedicated time to work our muscles, because it truly is use it or lose it, where without strong physical activity, particularly the resistance, like with weights or a machine, we want to work all our main muscle groups to keep them from deteriorating.
I know that you stressed, and I stress this also, that the person sees their doctor.
Yes,
and that
absolutely.
they have a doctor's prescription.
Yes.
And that one of the things that you stressed is that what you do is you make a program fit for the person's disability.
Yes.
And how to get the most benefit out of it.
Correct, correct.
Now, in all the years that you've been doing this, what kind of satisfaction do you get out of this?
Oh, it's wonderful. I have one 70-something-year-old client for personal training, and she says that when she's finished with her session, she has a physical sense of well-being. And you know, that's a paycheck to me. Or the cancer patient who comes in very weak and lacking energy, and then after a regular time of exercise says, "Oh, I have so much more energy now. I feel so much better, and my movement is increasing, and I'm sleeping better." That is just so rewarding. I've had cancer 2 times, and there wasn't a lot available when I was going through it, so it's wonderful that now there are these programs that are offered that can really help people, and again, something they can take charge of.
And now, how did you get into this cancer program, that there's special exercises for people who have gone through cancer? How did that start with you?
It was during that year I took off to obtain my fitness instructor certification. Yes. The professor there actually told me about the cancer exercise training to be a cancer exercise specialist. And then with such great support from Advocate Condell and the Center Club, my manager and the Center Club manager.
You developed a program.
We did. We did.
And I suppose this program varies from person to person because everyone has different degrees of it. Is that correct?
Yes, absolutely. And the exercise can even start prior to treatment, so we call it prehabilitation, to build up strength and endurance to withstand the effects of chemo or radiation.
So you recommend before they have even start any of their treatments that they establish?
If the doctor recommends it. So we do get many referrals from the hospital, from the radiation oncology department, when people are going through or finishing their radiation. We get referrals from oncologists who are local and connected with Condell, and they refer people.
And speaking to all these different groups, is this an outgrowth of your training?
Yes, and again, the hospital and my managers in particular have been very accommodating to provide and offer these types of things where we have the connections with the hospital and chances to integrate in the continuum of care from people, whether they're in rehab or post-cardiac event, post-surgery, after joint replacement. They then can come to the Center Club and we can work with their physical therapist and continue to develop a program.
Well, and now from hearing you describe all these different directions you can take programs, that it seems to take the stigmatism out of a person just walking in and say, where do I start? Because they're given personal attention.
Yes, that is definitely our goal. That's what we want to do, that it's take away. There's fear sometimes too, because if you're not familiar with a set of machines, it looks kind of scary. So yes, we're open for everybody and anybody and any situation.
Now, I know the hospital has a website, right?
Yes,
so
they
it
do.
would be Advocate Condell.
AdvocateHealth.com.
AdvocateHealth.com, and then they search out the Center Club on there, right?
Right. Mm-hmm.
And the different programs come up on there.
Yes, and they can find those free community guest days, and
so they can find them on the search if they go right to the website, right?
Yes, certainly. Mm-hmm.
Okay. Now that you have taken the programs this far, do you have goals that you have set for anything new that you want to do in the future?
Oh, I guess always looking to expand what we are doing and even expand our relationship with the hospital and the connection of, again, that continuum of care for people so that they are comfortable and welcome and their needs are provided for.
And you feel like this has extended your own health and well-being?
Oh, absolutely. You're in this environment, it's bright, it's active, there's energy, there's music. I believe also in, doing things on your own and staying active.
And you say you're a cancer overcomer yourself?
Yes. In 2001 was the most recent time. So I've been a survivor for a number of years.
So you can tell them from personal experience.
Yes.
The different stages a person goes through. Right?
Yes, and my husband is a survivor as well. So we are blessed and do enjoy every day of good health.
So if a person's at any age, you look in their camera and tell them what they're supposed to do.
Be as active as you can, be as strong as you can, use all your main muscle groups, and please come visit us and try out the Center Club.
And you know what? You know what time we've come to? When you come to the end of your rope, you tie a knot and you hang on. Now listen. I'm talking to you now because I don't know what time of the year that you're seeing this, but we're going into the summer months. And over the summer months, this is a good time to get outside or call up and do some kind of movement, because you know what I'm always saying, our goal is to live forever, so we have to push that envelope and break that glass ceiling that we're the first generation that is living this long, so we have to show those that are coming up behind us how to do it. So what we want you all to do this week is to catch the spirit. God bless you. We love you.
And we're out. Graphics. Okay.
Good.